Much, if not most, of the rhetoric on occupation speaks to a culturally westernised agenda that pushes only those socially sanctioned and health promoting qualities of occupation. Indeed, we know that sanctioned occupations are a product of social political processes that actively reinscribe dominant cultural ideologies. In the case of occupational therapy, it's those heavily westernised routes that have served to validate only those occupations that fit within the boundaries of what Western society would deem socially conventional or appropriate. The silencing and censorship of sexuality as an occupation, for instance, is a direct reflection of the profession's tacit compliance to westernised social norms that deem this topic as taboo. Had I not been enrolled in Margaret McGrath's stroke rehabilitation elective, my educational exposure to this topic area would have been virtually non-existent. This further evidences the collective and systemic avoidance of sexuality as an occupation, despite its significance to the human experience. Furthermore, even despite these structural barriers, nuances exist at an individual level when we overlay our own unique values, beliefs, and assumptions. As mentioned, there are those individuals, such as Margaret, challenging the status quo on sexuality and creating a respectful and professional way to open this dialogue. Because if you think about it, as OTs, we are perfectly positioned in our professional role to normalise discussions around sexuality. For many people who've recently acquired disability, sexuality and intimacy may be occupational areas of significance, meaning, and potentially concern secondary to physical and psychosocial changes they're experiencing. I think it's also important to flag here what we mean by sexuality and the caution we have to exercise in regards to heteronormative assumptions. Sexuality as an expression of occupation is much more than just sex. It may relate to gender identity and roles, sexual orientation, intimacy and relationships, and even things like grooming and dressing, how we present ourselves to the world, and these are just some examples. The evidence says that sexuality is important for quality of life for many stroke survivors, and despite this, less than 20% of people receive any information on the topic, even though it's a recommendation of the Clinical Stroke Guidelines. This is not to say that all health consumers may want or feel comfortable exploring this with their therapist, but really it's the health professional's responsibility to respectfully open the dialogue and give the client both permission and choice to explore the topic further and refer on to specialist services when necessary. The implication on a person's well-being secondary to silencing sexuality as an occupation can be really detrimental, particularly in the instance of newly acquired disability. This can lead to things like social isolation, internalized disableism, distress, rejection, altered self-esteem and self-concept, and even altered relationships. And these are all real consequences of failure to address this as an occupation. I remember feeling really inspired following Margaret's lecture on sexuality. I'd been educated and equipped with practical tools and scripts to legitimize and normalize conversations around sexuality. In an acute neurology setting, although priorities do focus on medical stability, Margaret had highlighted in her lecture that there is still opportunity to flag and normalise these conversations around sexuality, even as something to be revisited in rehab. I'm currently in week 4 of my placement, and the reality is that in no way have I felt comfortable, confident, or competent enough to break this silence. The workplace subculture itself isn't generative to discourse and discussions on sexuality, which certainly heightens my own hesitancy as both a student and a relative outsider to this working environment. In terms of sexuality as an unsanctioned occupation, I feel as if the barriers exist on both a systemic and an individual level. Systemically, it's a historically and culturally subdued area of occupation in which there is no real developed language for health professionals to embrace, though there is some pioneering work being done by Margaret McGrath and her colleagues. Furthermore, individually, I'm faced with my own anxieties as a young female discussing sexuality with people of different ages and gender, and yet somehow I'm happy to discuss their most recent bowel movement. I think given the evidence and the impact on quality of life, psychosocial well-being, relationships and perception, sexuality is an occupation that desperately needs a language that equips health professionals to confidently and competently open this dialogue, and at least give the health consumers permission to decline or further investigate aspects of sexuality of intrinsic meaning and significance.